Welcome back, everyone. Well, it was back in November when Maine voters approved the Maine medical marijuana law, but since then it's been difficult as to how to enact it. With us this morning is Dr. Botta, making a house call on our Fridays, and you've actually dealt with this being in the medical field as far as how the medical marijuana law works legally.
Yeah, thanks, Joe. I mean, being a specialist, I don't actually deal much with it, but my interest spiked when recently I had a patient who was hospitalized, and normally when a patient comes in the hospital, we transfer all their medicines they're on into their list of medicines they should take, and this is the medical reconciliation program. So we did that, but he asked the nurse, "Where is my marijuana?" So I had never dealt with that in the hospital setting. So I tried to find out from other colleagues who also didn't have any first-hand experience. So I called the pharmacy. And the pharmacy could give Marinol, which is a kind of a pill form of some concentrate extract, which is like, pharmacies are regulated by FDA, what they can and they cannot. And it's hard to regulate the doses or optimize the doses and all that from FDA point of view for marijuana. So then I started looking into this thing and how it all came about. And then I found that actually Maine got into it in 1999 when there was a question number 2. And as recently as you mentioned, last year they passed this question number 5, which has also increased the indications and how much you can have. So that you can have 2.5 ounces, you can grow 6 plants, no more. And then the indications include cancer and multiple sclerosis and intractable nausea or chronic pain and nail patella syndrome and a host of other areas where you can use that. So that's how it all came about. As far as my position is concerned, I have the same position as Maine Medical Association, which says neither this side nor that side. It's not kind of for or against, but it is being prescribed for many people, and it was an interesting setting that I came about to find out. And there is still a lot of unanswered questions, as we discussed earlier. You know, like, should you tell your employer that you are on medical marijuana, or should you tell your, if you are renting a place, your landlord that you're on medical marijuana.
So I know we were discussing during the break too, there's designated cigarette smoking sections, but would there be outside designated marijuana smoking sections? I mean, these are still, as you mentioned, still a lot of questions that, I know they've been debated in Augusta for quite a while as well.
Yeah, I think governor has put a task force to look into having non-profit dispensaries or having a identification system like medical card or medical marijuana card. So all this will play out as time goes on. I think it's a work in progress.
Sure. But as you said, it's interesting that already you've dealt with it, and I'm guessing it probably won't be the last time that you get that kind of question as well. All right. Thank you, Dr. Botta. Appreciate you
Thank you
talking to us about that. And we are going to be right back right after this.